Planning will involve answering the who, what, when, where, and why questions. Who and what involves nursing leadership, the nursing supervisor, and wound care champions who will collect baseline data to find out what measures are already in place and what changes can be made. It also involves the clinical nurse who will implement the changes. What measures are in place and what the prevalence of pressure ulcers on the unit is. Why? For the last 3 years, our ICU did not have any reportable pressure ulcers, and in the last 6 months, there has been 3 reportable injuries so far. The when and where will involve all shifts and will occur in the ICU. How? How will data be collected? Through chart reviews and audits with predetermined questions to make sure all measures are implemented. Planning also involves answering what the objective is and what we think will happen. The objective is decreasing the amount of reportable facility-acquired pressure ulcers. Step 2 in the Plan, Do, Study, Act cycle, the Do part of the cycle, will involve implementing the proposed changes. We will continue to implement current measures such as using turn clocks, turning patients every 2 hours, keeping the head of the bed elevated, doing shift change 4 eyes assessment, and adding to current measures the use of foam dressings on all patients admitted to the ICU, to their coccyx and to their heels, and use turning wedges for repositioning. The only other change we will make is eliminating the new chuck incontinence layer that we started implementing this year, as our director feels that this is the only new change that has been implemented recently, and her prediction is that if we switch back to the previous chuck, we will be eliminating pressure ulcers in our unit. The study part. As we implement the new measures, leadership will continue to audit and educate staff to implement the changes while studying and analyzing the data collected during audits and see if the new changes improve the outcomes and if it lines up with the predictions. Once definitive data is available and we can say with certainty that no further pressure-related injuries occur, we can act and officially discontinue the use of new incontinence pads, revert back to the old ones, change policy, and implement the changes hospital-wide.